Good morning to all of those who make this broadcast possible, to Abdiel, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 8,404 people are hospitalized in Cuba. 6,483 are under observation. There are 1,349 suspected cases and 572 confirmed active cases. Yesterday, we processed over 7,000 samples, 7,779, in our various molecular biology laboratories. 2,234 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 984 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 930 in Havana's, 404 in Santiago de Cuba's, 462 in the Naval Hospital, 453 in the Manuel Fajardo Hospital, 430 in the Hermanos Almahedas Hospital, 412 in the Molecular Immunology Center, 376 in the Genetic Engineering and Biotechnology Center Lab, 308 in the ICA laboratories, 300 in the Fructuoso Rodriguez Hospital, 280 in the Civil Defense Laboratories, and 206 in the National Center for Genetics. Of these 7,779 samples processed, 40 tested positive for COVID-19. That's 40 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 577,150, of which 5,350, or 0.93% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested, with a high number from Havana, Matanzas, Villa Clara, Sancti Spiritus, Ciego de Ávila, Camagüey, Santiago de Cuba, Granma, and 98 samples tested from the Isle of Youth Special Municipality, as well as all of the country's remaining territories. All of the 40 positive cases diagnosed yesterday are Cubans and are linked to episodes of local transmission. Yesterday, no imported cases were diagnosed in the country. 39 of the 40 positive cases diagnosed yesterday are confirmed case contacts. This means that 4,852 people, or 90.6% of all diagnosed cases in Cuba, had contact with someone who had previously tested positive for the virus. This is the group at highest risk of infection. Of the 40 cases diagnosed yesterday, the source of infection linked to one is yet to be determined. The source of infection in 57 cases reported over the last 15 days is therefore still being investigated. Yesterday, as I mentioned, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 441, or 8.1% of all diagnosed cases on the island. Of the 40 cases diagnosed yesterday, 23 are male for 50.6% of all cases, and 17 are female, representing 49.4% of all diagnosed cases on the island. 37, or 92.5%, of the 40 cases yesterday were asymptomatic at the time of testing. Overall, 60.2% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 67.7% of cases over the last 15 days. By age group, 9 positive cases diagnosed yesterday are under the age of 20. 7 of these are under 18 years of age, for a total of 583 children, or pediatric cases, to have tested positive for the virus in the country. Of these, 501, or 85.9%, have recovered from the virus and been discharged from hospital. Meanwhile, 14 people to have tested positive for the virus yesterday are between 20 and 39 years of age. 15 cases are between 40 and 59, and 2 are over the age of 60. Of the 40 cases diagnosed yesterday, 23 belong to Havana and 17 to Ciego de Ávila. The 23 cases from Havana belong to the municipalities of Centro Habana with 6, 10 de Octubre with 3, Habana Vieja 3, Boyeros 3, Arroyo Naranjo 3, Cotorro 2, Habana del Este 1, Guanabacoa 1, and Regla, also with 1 case. All of the 17 cases from Ciego de Ávila belong to the municipality of the same name. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 55.37. Havana follows with 18.41, then Matanzas with 10.28, Sancti Spiritus with 6.01, Artemisa 4.97, Mayabeque 2.86, Camagüey 1.18, Cienfuegos 0.49, and Holguín with 0.39. Meanwhile, Pinar del Río, Las Tunas, Villa Clara, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have reported no new cases over the last 15 days, some of which have reported no new cases for several weeks, and others none over the last few months. Cuba's rate therefore stands at 7.02 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,350 people who have been diagnosed with the virus thus far in Cuba, 572, or 10.7%, are active hospitalized cases. Of these, 565, or 98.8%, are clinically stable. Yesterday, no one died as a result of the virus, meaning that the COVID-19 death toll on the island remains at 118, with a mortality rate of 2.20%, lower than the global rate of 3.06% and regional rate of 3.37%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 45 people were discharged from hospital, a positive result when compared with the number of confirmed cases diagnosed yesterday. 12 people were discharged from hospital in Havana, 1 person was discharged in Artemisa, 6 in Sancti Spiritus, 21 in Ciego de Ávila, 4 in Camagüey, and 1 person was discharged from hospital in Holguín. This means that, to date, 4,658 people, or 87.1% of all confirmed cases in Cuba, have recovered from the virus. Today, 2 patients being treated in Camagüey continue to be in a critical state. Meanwhile, 5 patients in hospitals in Havana and Camagüey are also reported as serious. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 310,906 people were diagnosed with the virus, for a total of 31,969,479 confirmed cases since the start of the pandemic. Yesterday, 6,451 people died of the virus worldwide, for a total of 978,284 COVID-19 fatalities and a global mortality rate of 3.06%. The region of the Americas, which accounts for 50.15% of all cases worldwide, reported 113,174 new cases yesterday, for a total of 16,032,713 people to have been diagnosed with the virus. Meanwhile, 3,695 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 541,624, and a mortality rate of 3.37%. The United States continues to top the list of countries worst affected by the pandemic, with 6,934,204 confirmed cases and 201,909 fatalities. India has 5,732,518 cases and 91,149 COVID-19 related deaths. Then comes Brazil with 4,624,885 confirmed cases and 138,977 fatalities. And in 4th place comes Russia with 1,122,241 cases and 19,799 deaths. From the Americas, after the United States and Brazil, comes Peru, Colombia, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, the Dominican Republic, Panama, and Guatemala. These are the countries with the highest number of cases in the region. Cuba occupies 20th place on this list. Regarding mortality rates, Mexico has the highest, with 10.56%, followed by Ecuador with 8.6%, Bolivia with 5.86%, and Peru with 3.16%. This is the information we have on the behavior of the pandemic in Cuba and the world.